coordinator of the German Biobank Node. In addition, she is also coordinating the local biobanks of the German Cancer Research Consortium. Cäcilia studied biology at Julius-Maximilians University in Würzburg, and she wrote her diploma in molecular and microbiology. Her PhD thesis she wrote at Max Planck Institute for Infection Biology and at Humboldt University Berlin. She joined the office of the German Biobank Network office at Charité in 2018. The topic of Cäcilia's talk is the Sample Locator, a federated search for biosamples and associated data. Cäcilia, we are looking forward to your talk.
Thank you very much for your invitation and introduction. I'm very pleased to present to you the Sample Locator in one of your tool talks for NFDI. As I said, or as I was introduced, I'm a classic biologist by training, but lately strayed towards bioinformatics and further down that line to information technology, IT. So that is what qualified me for this joint venture in data science. What is the German Biobank Node? It is a central cooperation platform for academic biobanks at German university locations. It's funded by the Federal Ministry for Education and Research, so BMBF. And the aim of the initiative is to network biobanks and make them much more visible. Biobanks. What is biobanks? So it's not about money. It is, we also use the word biorepositories. So often it is core facilities at universities where human samples of consenting patients are collected to enable biomedical research with these samples. So the vision of our funding agency was to support these biobanks' work of collecting tissue and liquid samples, or their processing to extract DNA or RNA, and storing these in highest quality procedures so that they can be used in biomedical research later on, and thus result in reproducible publications since they are comparable in the way they were harvested. The German Biobank Node is responsible for bundling expertise in biobanking across Germany, but is also the central contact point for all biobank stakeholders. So researchers, clinicians, biobankers, patients that donate their samples. And it is also a national representation of the German biobanks in Europe that would be the biomedical research community in Europe. BBMRI, Eric, you see this logo down here. The network has been grown since 2017 to now about 35 locations all over Germany, comprising of partner biobanks and observer biobanks. So partner biobanks have a QM, quality management and IT facilities, and the observers are getting there. So that we're helping them on their way. We have expert centers for IT as well as for quality management in Heidelberg at DKFZ IT and in Heidelberg at Universitätsklinikum and in Jena for quality management. So the common goal of all the entire network is to make high quality comparable biospecimen associated with the data available for biomedical research. So I'm here today for the IT package of this alliance, or German Biobank Alliance, and the defined mission of this work package was to connect the individual biobank location that I just showed on the slide before, and develop an IT infrastructure in coordination, in cooperation with DKFZ to enable researchers to find the samples they need for their research, or to source even more samples than they have collected themselves or find at their own site. To get there, we made an requirement analysis, decided on the operation mode for a federated IT team of 9 sites all over Germany, developed the approach itself, and kept the ties with related national and international initiatives, as for example, Medical Informatics Initiative, MEE, or this European umbrella organization for biobanks that I just mentioned. So what we constructed over the last years is now this IT network for biobanks that comprises of the so-called Sample Locator that I will be showing you next, a biobank directory, which is a central synchronized directory with European ties as well, and the communication tool, the so-called negotiator, that is connected to both these tools, and I will show you that as well. So this is basically what we're doing to support search of samples in different biobanks at the same time. The IT structure, infrastructure, architecture underneath the hood is a bit more complicated, of course. It has a so-called bridgehead that is installed locally and keeps all data locally, and has a consented data set that enables the heterogenic data aspects to be queried homogeneously. This bridgehead is based on FHIR, so the Fast Healthcare Interoperability Resource, HL7 FHIR, and the search works via the clinical quality language, CQL. Authentication and project management, so the central services, are sourced as well with this European initiative that I was talking about before. The entire code is open source to ensure sustainability, and the infrastructure is productive since October 2019. So it's alive and kicking. These bridgeheads storing data locally are used to harmonize the data from local sources that come from not only the biobank, but adding data to the samples by using data from the clinical system as well, which enhance their use cases. So if you know what the person that donated the data had as, for example, other diagnosis, that of course gives you a broader range to work with. So I will give you just a live presentation of the tool, which I think is best to understand. samplelocator.bbmri.de is the URL. We also have a European instance, BBMRI-EU would be the URL then. Yeah, so we have the search part and the results part. And I'm clearing everything now. I can add, for example, one very common request currently, of course, is request for samples with COVID disease association. So I can enter the ICD-10 code for, 07. For COVID, or add another one for not proved COVID. So this one, these parameters can be added by or, as well as by and. I can add, for example, sex of the donor, or whether the donor has had food beforehand, before sample donation. That is important. For example, if you use liquid samples, then it is necessary to have that information. I can choose which sample type I would want to search for, diverse blood types, or DNA, RNA. I can search for tissue types, frozen or fixed in formalin. I can add these with and then send this request as a feasibility request. And now the tool asks all the connected biobanks in real time, so you can see counting up number of biobanks, number of donors, and number of samples, and an overview or breakdown of age or sample gender, diversion, and sample type. This is a feasibility search, but if you log in for results per biobank, it is possible to see which biobank has how many samples in their storage. Authorization works with the Deutsche Forschungsnetz, I don't know the English version, that can use your institutional account, the one that you usually employ when logging in at your computer. And then you can see all the connected locations and how many samples from how many donors would possibly be could possibly be had. Of course, since the data stays, data sovereignty stays with the location, you will now have to get in contact with these these sites and start negotiating. This is the other tool that I was speaking about, the negotiator. So I just clicked negotiation with Berlin and Jena. Then the next tool opens and you fill in your desired, so your project description and you desired samples. So the amount you need or volume or other specifications required. Yeah, that basically is the tool. And as I said, it is alive and working. And we are still developing further the UI currently. So the user interface has been subjected to exploratory studies with how do you say, Rückfragen. So yeah, randomized design over a period of 6 weeks and developed to what it looks today, but it will be enhanced further to accommodate additional parameters like oncology requests, specific TNM values, and so on. Yeah, so that was our sample locator, and thank you for your attention on behalf of the German Biobank Node and the German Biobank Alliance, all the IT people, developers and administrators that helped here, the developers at DKFZ and at Erlangen, and of course those from the European project as well. And I'm looking forward to your questions now.